Hi, I'm Dr. Steven Sandifer, and this video is on inflammatory disease. I'm going to be talking about the physical or the osteoarthritis and the rheumatoid arthritis versus the autoimmune disease. With the physical osteoarthritis and rheumatoid, there are 100 different types of them. And then for the autoimmune, there are about 80. So we're going to take and talk about how things get turned on, but they don't get turned off. And that's where the problem is that it goes from an acute to a chronic problem. So some of the symptoms that we can have with arthritis is the joint pain, the achiness. I think that's the most obvious thing on there, but it doesn't have to be that you have a pain or an ache. You can also have some stiffness. And maybe the tendon as you're moving such, and it's tendinitis. Another symptom is loss of motion. I can't quite move and turn like I used to. Sometimes you'll get a throbbing, like a impulse artery, kind of a throb, achy in there. Another is you can actually feel the joint and it's got some heat, it's red. So those are some of the symptoms that I see. So treatment-wise, chiropractically we look at the spine. The spine is our core, where everything moves off of. And so we look at the neuromusculoskeletal system with motion and position. And that if we are stuck and we're not moving, we're not circulating. And that's very important. Now with arthritis, it's not only at the spine, but it's also in other joints of the body. With knowing that, I've taken classes and have treatment for wrists, elbows, shoulders, clavicles, first ribs, cranial, hips, knees, and feet. So we take and treat the whole skeletal system. So treatment-wise, being a chiropractor, I look at the foundation. The foundation is the spine. It takes and moves everything else off of it. There is 26 movable vertebrae that have 6 joints, 1, 2, 3, 4, 5, 6, that need to be balanced and movable. So we use our hands to detect imbalances and dysfunction, and we detect and correct with some drop pieces. Makes it very easy and comfortable for patients. The other thing that we do is we look at how strength and flexibility is working. So strength is important for the body in that we need to first realize that we don't get strong and circulate by sitting in the recliner, but then again we can't be always moving. So there's a balance in there of to be active and rest inactive, but we're talking about active. So strength-wise, we start with what's called abdominal bracing and get that level built, and then we move on to what's called dead bug and then quad 4. And once you have the front part and the back part built, then we move on to weight bearing and band exercises, which is from the inflated ball and band work. So we work through that, we get some strength going. Flexibility, we start off by teaching 6 stretches in the 3 planes, and we progress from there. Now, we also look at balance too, because the less stress strain that you put on your spine, the less inflammatory you're going to have. So we look to take and have things level and plumb. Now I want to talk about nutrition. How can we help what the switch has been turned on, how can we get it to turn off? There are the from standard process, there's a Ligaplex 1 and a Ligaplex 2. Ligaplex 1 is more for the acute strain or sprain. Somebody's had a fall or repetitive. It's more the time of acute. Now, if it's more chronic, and then we get into Ligaplex 2. So the acute is for the strain sprains on there, repetitive motions and falls, but how about the postural? When that's more of a chronic on there, where the ear to shoulder going forward, how many of us are doing our phones and now we're putting stress strain? So posture we can do something about, and we can help strengthen our system through the Ligaplex 1 and 2. Now, another thing to take and decrease inflammatory through the nutrition is the oils. And some of the oils that we suggest is just using regular butter when you cook, and also coconut oil. Olive oil is also good. So you want the good fats to take and damper down the inflammatory response. The other oils that we do nutritionally in our office are wheat germ oil and tuna omega oil. And the last thing that we do nutritionally is the trace minerals. Now, this is the basis for what we are. There are vitamin D, there's vitamin B, there's other things that our body can use, and we are here to take and do some detection and correction to see which would benefit you. So if you have some causes for the inflammatory response to turn on and you're still struggling with it, need some help to turn it off, whether it's acute strain sprain, repetitive, postural stresses, or more of a chronic where there's weakness and imbalance, we would like to take and see how we can help you to get it turned back off and get you living the lifestyle, the active lifestyle that you want and need. So I'm Dr. Sandifer, and thank you for tuning in for the inflammatory physical aspect that we work with. Look for our next video, which is going to be the autoimmune diseases. We'll see you then.